Hello and good afternoon. I'm really sorry that I can't be with you guys physically at this point because I have a clinic, which unfortunately clashes with this talk. But I'd like to join at the end of the day to answer any questions. I'm going to take a few minutes to talk about why should one choose a career in hospital medicine. And you may know that by hospital medicine, we use this broad term where it might actually be medicine that is practiced in the transition between hospital, intermediate care, and often into primary care outreach, as you will see in some specialties like dermatology, rheumatology, and others. But I don't want to preach you something that you already know, but I'm just going to share around 25 plus years of experience as a physician and tell you what are the things that I've enjoyed most in hospital medicine. What is it that excites me still, and why I look forward to coming into work whenever I'm on call or whenever I'm seeing patients. And see if you can find some things that resonate with you in this process. Perhaps I'm an imposter because when I was much younger, I wanted to be somebody very different. I wanted to be a nature photographer, a writer. National Geographic was my mission, my passion. And then suddenly one day my mother said, "You're going to be a doctor." And that was the end of it all. And here I am. So let's talk about hospital medicine. So there are some reasons that I want you to consider. Firstly, hospital medicine is a very broad base of around 37 specialties, which are as diverse as you can imagine in their range. So there is something for everyone and something that will suit everybody's interest and personalities. So choose wisely. You don't have to make very traditional choices. The other important thing I want to talk about is the flexibility. So there is an opportunity within medicine of choosing either a very niche area, like the right lobe of the liver, or a particular molecule that affects people, or a particular virus, for instance, the HIV, or if you're interested in infectious diseases, the latest coronaviruses. But equally, you can be very broad, in looking at how things are, and you can pick big specialties. So there is an incredible amount of flexibility. And again, depending on your own personality and your own interest, you can tailor it to as broad or as narrow a particular discipline that you like. The other important thing is that you could be basing your entire life in a office room, a desk space, working on a computer, working in a laboratory. Equally, you could be, absolutely at the front line, saving lives, doing stuff if that excites you. So again, there's a fantastic opportunity for you to choose a workspace or an area which again suits your personality or your interest. And also, there's a very broad aspects, like you can be immersed in absolute science and genetics and molecular level, or you could be working in palliative care, perhaps, where you are sitting with patients, demonstrating or sharing your passion, your empathy, and really making a huge difference. So whatever you do, you will be making a significant difference to the lives of people. And ultimately, when you boil all of this down to what is it about hospital medicine that really is at the core of this? At the core of this is your desire to work collaboratively in a team, work with multiple professionals, multiple people from other disciplines, in order to do one thing, which is make a difference to a patient's life. And the other interesting thing is that you can be, do multiple specializations. For instance, I trained in general internal medicine and respiratory medicine, and now I do acute medicine, which is quite a very different area of work. So similarly, there is a whole range of options that allows you to be who you are. So let's talk a little bit about medicine. So whenever I look at a particular subject, I would look at it in three different ways. Firstly, the highest level or highest tier of looking at anything is the philosophy. And then we will be talking a little bit about the art of medicine. And then we'll be talking about the science of medicine, which is the basic nitty-gritty of this. So if you think about the philosophy of medicine, medicine itself is about physiology. It's about how this wonderful body, the human being, exists, both in its neurological form, cognitive form, and also in its physiological form down to the membrane movement of sodium and potassium across the channels. And we know, and with your understanding of physiology, you will understand why even minute differences in sodium and potassium levels or calcium levels can make a huge difference to the entire human. So one of the fundamental things I would say that you have to have a passion for is the understanding of how the physiology at chemical level actually relates to the bigger person, the bigger picture. So if physiology or pathophysiology doesn't excite you, medicine probably is not the best place for you to be. The other important thing here is the interconnectedness. So there is a connection between how people feel, what they perceive, what they wish for, and what their body's basic physiology is telling them. So that connection is something that as a physician, you will need to understand, digest, and use to the advantage in helping your patients. Remember also that even though you may have done years and years of practice in medicine, years and years of training in medicine, the patient may not see eye to eye with what you think is right for them. And people have the autonomy, and that makes humans so individual and so worthy of attention, that their autonomy is something that you will learn to respect. I mean, I remember that when I was a junior doctor, I would be incensed by the idea that, a patient with diabetes would not follow dietary advice or would not take insulin. And however much you try and explain it to them, or to an asthmatic that, the importance of inhaled corticosteroid, they may completely look at it in a different way. One of the things that I learn, and all of us learn as we get more experienced in medicine, is that you need to learn to listen. You need to learn to understand what your patients want. You need to then tailor your advice in a way that makes sense to them. And only then you can wish for somebody to accept your advice. And in many cases, you have to accept that no, you haven't managed to connect, and they may not be able to follow your advice, and you have to respect that. So one of the key skills that you need to find within yourself is negotiation. So you have to be a fantastic negotiator. You have to be able to see eye to eye with your patients, understand where they're coming from, and try and make some sort of a truce with them, so that you can then help them. If you're not able to understand diversity of views amongst your patients, understand that they may be coming completely from a different angle, and they may not see eye to eye with you, then there will be a lot of frustrations and bumps on the way. So from there, we should move to the art of medicine. The medicine is all about, the uncertainty and the art of probability. If I'm quoting William Osler. Now, what do we mean by that? One of the things that incenses patients sometimes is that when they come to a doctor, they expect you to be telling them exactly what's wrong with them, and to be reassuring them that you have the absolute right treatment for them and that you will make a difference, and they will get better. That's all what patients want. But you and I know that medicine is about probability, and there's a lot of uncertainty about a well-known condition, in different individuals. Now, how do we portray that uncertainty and that probability to our patients without making them feel that you are experimenting with them? Many times when I have been really candid with patients about a condition which we are not clear about, patients would say, actually, I don't want to be a guinea pig. If I say, let's try this antibiotic or let's try this particular treatment, see if it works for you, they'll say, oh, are you using this as an experiment? I don't want to be an experiment. So there is an art in this, and there's an art in explaining to them, why, you cannot be, or no one can be 110% sure about something. And it's about how your body reacts to something that we know works in certain cases. So your understanding of the evidence base is absolutely critical to be able to give that advice. You don't need to quote exact proportions or probabilities or percentages to your patients, but you have to convey this. And in order to convey this in a convincing way to patients, you have to know your science and your mathematics very, very well. But it's the art of how you present your information, how you are true to the evidence, and how you help your patients reach the conclusion that you think is best for them is absolutely key. And it's very different. It will be different for each and every one of you. And that is the beauty of medicine. It's not repetitive. It's not monotonous. It's absolutely diverse as every individual practitioner, yet the goal and the outcome is very, very similar. Let's talk about science of medicine. Obviously, you cannot do the art or the philosophy of medicine unless you know your basics. So you have to understand the physiology, you have to understand the chemical reactions, you have to understand genomics. And this is absolutely important. And I did mention the passion for physiology. You have to have a deep understanding of how the human body reacts. And without that, you can't be successful in medicine. So look deep within yourself. Is that something that you enjoy doing? And if you do, then this is absolutely the right place for you. And if you don't, then there are so many other disciplines within the broader medicine that you can look at. Understanding pharmacology, pharmacodynamics, compliance is also very, very key. And then ultimately, how that science translates to real patient outcomes that you can discuss, that your patient is able to discuss with their non-medical peers, is where your success will be counted. Let's move on to sort of a little bit more about careers. So we've talked about how the science and the art and the philosophy will combine together. Let's also talk about, let's say if you want to do procedures, for instance, you're very good with your hands, you've got excellent, skills with your fingers, you've got excellent visual, spatial recognition skills. You could love to do procedures. I mean, I was taught, I remember when I was a registrar, I was taught bronchoscopy by 2 consultants. Prior to that, I knew nothing. And when in my first year, the first consultant taught me bronchoscopy using my right hand to hold the bronchoscope, left hand to guide the tube into the patient, and with the patient sitting up and talking to you or listening to you. And the other person on the second day would teach me completely different. The patient has to lie on the bed, you have to hold it in your left hand to guide it with your right hand, and you come from the back of the patient. So that was initially, it could have been quite confusing, but I found that actually trying it in 2 different ways, using both my hands, actually made me a much better operator at the end, and it became really important. So when I was teaching bronchoscopy in my earlier job as a chest physician to new registrars, I adapted my techniques to their own skills. So again, if procedures is what you like, there's plenty of procedures within medicine, and you may enjoy doing them. If you're a cardiologist, you would be doing more plumbing than any plumber has done. So there's incredible stuff in there. But ultimately, it's all about passion, compassion, and making a difference to your patients. Now, When I talk about portfolio careers, I mainly mention that it doesn't have to be a textbook or a copybook, a prototype that you have to follow. You can devise the proportions of the science, the art, the passion, the procedures in your career as you feel that is best balanced for you. And I think that is a very important thing. The flexibility that the medicine allows you to maximize your own skills is absolutely important. And I think you can be flexible in how you conduct your training. You can train in less than full-time roles. You can train, in different specialties. The speed with which you train can also be variable. You don't have to finish things within absolute times. You can take more time in areas that you feel you need more time. And you can also tailor your training to include various subspecialties that excite you in the beginning. You can also choose how intense or how busy the job needs to be, and what balance of research and science with the frontline stuff that you want to enjoy. And ultimately, I mean, I think it's a misnomer when people say that it's absolutely structured and you cannot be flexible. You can be really flexible, and you don't have to follow a particular pathway. You can actually create your own pathway, and even though you may be in a training program, it's very possible to tailor it as you feel right for you, and that might change in different times within your career. So I normally look at my career not as a 35 years of consultant or 40 years of consultant or something like that. I look at life and my career within sort of bite-sized windows, and I usually use a 5-year plan. A 5-year plan is basically that I plan out how my next 5 years is going to look, and every 3 or 4 years at the time before I get to the 5-year point, I would reflect, review what I have achieved. Is it really what I wanted to do? Is it really what I'm enjoying at this present time? Have my views changed? Has my passion changed? And if that happens, then you have to tailor. So, for instance, when I started out doing my Ph.D., I was keen to be an academic, and I wanted to follow an academic career. And I thought my mission would be to be a professor in a laboratory doing sleep medicine. And then at the end of that, when I came out of this and I started enjoying the interactions that respiratory medicine offered, I thought, oh, wonderful! I want to do a job where I can do everything. So I was doing clinics in COPD and asthma and sleep and everything else, and I really enjoyed it. At about 4 or 5 years, I thought, I've seen everything that has to be seen in COPD. And I've seen about 3,000 asthma patients. And I thought, I can't take any more of this because this is all the same. So then I changed and I came and did acute medicine. And acute medicine, gives me incredible variability. So again, it's not necessary that, you stick to what you decided at the age of 18 or 22 or 25, whatever you're making. You can alter and change as your priorities change in life. And I would say always reflect on this, reflect on the path that you're following. Look at yourself and see whether this is what you want to be. This is where you be. The other important thing to have, if you can, or if you haven't done it by now, is to develop long-lasting mentoring relationships. So find, senior physicians or, surgeons or whoever that you feel can understand you and that you understand them, and maintain that relationship, with somebody senior in your profession, so that wherever you're doing, whatever you're doing, just touch base with them, check with them, reflect your views with them, and that'll help you really focus your mind on this. Ultimately, it's about excitement. You need to come to work feeling excited about this. You need to think, you need to finish work tired but happy. And if that's not happening, then this is not for you. You need to flex it. You need to change it. You need to go and do something else. And Don't ever feel that you cannot change. You have to be bold. You have to accept that, look, this is my life. I have one finite life. I'm going to do the best I can with my time and my talents and my potential. I'm not going to make any mistakes here. And if I do, I'm going to correct and move forward and change. I think that is a key thing. So I would encourage all of you to consider an out of program training. Whatever you're doing, take time out, 1 year, 2 years, 3 years, do a piece of research, do a leadership program, do education, do a DASI fellowship, go and do an extra degree in this, whatever you wanted. Politics, law, management are popular areas, but it doesn't have to be that. It could be fine arts, it could be the history of medicine. So take a gap year, take many gap years, go and do things that really, really matter to you, because that will refresh you and stop you from losing, the passion that is important. I'll just finish with a couple of points on workload. Now, there has been a lot of bad press about the workload in medicine. People say, oh my God, medical registrar is the worst job in the country. And that is something that some people quote as a reason why they don't want to do hospital medicine, because they don't want to be a medical registrar. But actually, medical registrar is the most valued and the most vital job in the hospital by any means. There is no other job in the hospital which has so much of responsibility and so much of contribution than a medical registrar. And I think that is important to remember. It is not needed to be a baptism by fire. You don't have to be, burnt and battered and bruised in this experience. It's a fantastic combination to try out leadership, management, escalation, negotiation, and delegation skills. It's an absolute, once you've done a couple of years of that, you will become 10 times a bigger person than you've ever been. There is plenty of supervision. You'll never be left on your own. There's also incredible opportunity for you to actually tailor the intensity of that job or the duration of that job as you see fit. You're not expected to do something that breaks you. And you must keep it to a level that you enjoy. It is so much more important to take a scenic route and not go directly down a motorway hurtling, and you will find so much improvement. And ultimately, finding a mentor who you can talk to. Now, after all of this, you've done this, and about 2-3 years into your thing, you just into your medicine, you discover, actually, this is not what I wanted. This is not what I see myself as. It's completely normal to consider that this is not what it is. And if your excitement is not there anymore, if you don't see the passion in medicine, no problem. You need to just stop, reflect, think, talk to people, and change direction. It's completely normal to do so. And lots of people have started off in some place and have really gone to something completely different. I may end up in somewhere very, very different to where I am now. My passion for writing and for publishing and stuff is going so much that I may suddenly give up all of this and go and do something else. Again, life is short. You have to do what you really, really enjoy. The Royal College of Physicians has got this motto that medicine is brilliant. And even after 25, 28 years actually of medicine, I would have to agree with that. I think medicine is brilliant. I'm still excited every morning that I come on my on calls. I'm excited by the fact that I don't know what the next patient will present with. And that is fantastic. There's lots of resources you can look at the College of Physicians. You can also look at the different specialties and the joint Royal Colleges, training board. And if you haven't picked up an interest in Sherlock Holmes or House, I guess both are the same, then this is your time to go and discover something amazing. So watch that series, just binge watch it, and then you will never regret being in medicine. So thank you. I will leave you now. And I think Lily will be talking to you about the more practicalities of how to apply for medicine, how to look at your CV, how to improve it. And I'm very happy to take any questions either by email or later on when I join back and answer any queries. And thank you for listening. Enjoy.